Welcome to my channel. For your health, don't forget to click to subscribe. Do you think eating nuts is good for your health? Be careful of these 5 invisible killers that are wearing down your kidneys. Have you ever munched on a bag of salted cashews while watching a TV series late at night, silently saying to yourself, nuts are nutritious, so it's always a good idea to eat more of them? Or maybe you guzzle a spinach nut smoothie after working out, believing it's a natural kidney tonic. However, clinical data show that the number of patients with kidney damage due to long-term improper consumption of nuts is increasing at a rate of 10 per year. Anna Florigeddle said bluntly, "I have encountered patients who eat pistachios as meals. 3 years later, their kidney function directly dropped below 30 of the normal level. Even if I give them 10 kidneys, it is not enough for this kind of tossing." As the precision filter of the human body, the kidney has to process 150 to 180 liters of blood every day, equivalent to filtering the whole body's blood more than 20 times. But it is a silent ascetic. Even if half of its function is lost, it may not issue any alarm. When you finally notice back pain, frequent nocturnal urination, and swollen ankles, your kidney function may have fallen below 30 of normal. Today, we will peel off the complex relationship between nuts and kidneys, reveal the true face of 5 kinds of nuts that hurt kidneys, and present a set of kidney protection guidelines that everyone can operate. Each person has a fist-sized kidney hanging on both sides of the lumbar spine. This pair of seemingly inconspicuous organs is actually the busiest biochemical factory in the human body. Blood purifier, about 150 to 180 liters of primary urine are generated every day, which are precisely processed by the renal tubulus and finally concentrated into 1 to 2 liters of urine, completely excreting metabolic waste such as urea and creatinine. For example, the kidneys are equivalent to completing 20 hemodialysis for the body every day. Electrolyte balance. Accurately regulate the balance of minerals such as potassium, sodium, calcium, and phosphorus. When you eat salty food, it will accelerate the excretion of sodium. When you exercise and sweat, it will retain water. This dynamic balance directly affects the heartbeat and muscle contraction. Blood pressure regulator. Secretes hormones such as renin to maintain blood pressure in a stable range by constricting blood vessels and regulating blood volume. Clinically, about 30 of hypertension cases are directly related to abnormal kidney function. Life Activator. Activates vitamin D to promote calcium absorption and prevent osteoporosis. Secretes erythropoietin to ensure that the bone marrow continuously produces red blood cells to avoid anemia. Even more frightening is the endurance of the kidney, like a sophisticated instrument with redundant design. Even if one kidney completely loses its function, the other side can support itself for several years. Data show that patients with chronic kidney disease often experience obvious symptoms, such as fatigue and nausea, when their kidney function drops to 30 to 40 of normal, and they may not notice it before that. Kidney dysfunction is like pushing down dominoes. Blood potassium imbalance. When the kidney's ability to excrete potassium decreases and the blood potassium concentration exceeds 5 mol/L, it will cause myocardial paralysis, and in severe cases, it can cause cardiac arrest within minutes. A kidney patient ate 20 pistachios and his blood potassium level suddenly rose to 6.8 mol/L. He was sent to the ICU overnight for emergency treatment. Calcium-phosphorus rebellion. Abnormal phosphorus metabolism can cause blood calcium to escape from the bones and deposit in blood vessels and kidneys. A dialysis patient who ate pumpkin seeds for a long time eventually had lower limb gangrene due to vascular calcification and had to undergo amputation surgery. Toxin accumulation. Metabolic waste such as urea nitrogen cannot be excreted, which will trigger a systemic inflammatory response, from skin itching to digestive tract ulcers, and even affect brain cognitive function. Are nuts healthy snacks? There is a kidney burden behind these nutrients. The golden nutrition of nuts. Why do doctors recommend eating nuts? Nuts are called concentrated nutritional treasures by the nutrition community. Their health value comes from four core ingredients: blood scavenger, omega-3 fatty acids in walnuts and monounsaturated fatty acids in almonds can remove bad cholesterol, LDL, from the blood vessel walls like detergents. Studies show that people who eat nuts 3 times a week have a 17% lower risk of cardiovascular disease. Plant protein library. Every 100 grams of peanuts contains 25 grams of high-quality protein, and the amino acid composition is close to animal protein, which is an ideal protein source for vegetarians. Dietary fiber network. 30 grams of cashews contain 3 grams of dietary fiber, which is equivalent to the fiber content of half a bowl of oats, which can delay the rise of blood sugar and make the feeling of fullness last longer. Mineral Magic Cube. It is rich in minerals, such as magnesium regulating neuromuscular excitability, potassium maintaining heart rhythm, and zinc enhancing immunity, especially vitamin E, whose antioxidant capacity is more than 10 times that of vitamin C. The key to the problem lies in imbalance of ingredients and excessive intake. Potassium sweet trap. Pistachios contain about 1,000 mg of potassium per 100 grams, which is equivalent to the potassium content of 2.5 bananas. People with normal kidney function can excrete excess potassium through urine, but the kidney potassium excretion channel of kidney patients or the elderly kidney function decreases by 1% each year will become narrow, which is easy to cause hyperkalemia. Phosphorus is the bone calcium thief. Pumpkin seeds contain 1,100 mg of phosphorus per 100 grams, which is more than 60 of the daily requirement for adults. When the kidneys cannot excrete phosphorus in time, the parathyroid glands will be forced to command the bones to release calcium to neutralize it, resulting in a two-front battle of osteoporosis and vascular calcification. Oxalic acid is the stone factory. After the oxalic acid in almonds enters the human body, if it is not completely metabolized, it will combine with calcium to form calcium oxalate crystals. 20 grams of almonds contain about 120 mg of oxalic acid, which is equivalent to the amount of oxalic acid in 10 leaves of spinach. Long-term excessive consumption will increase the risk of kidney stones by 30. These 5 nuts are kidney killers. You may eat them every day. The top dangerous element, salt-baked nuts, invisible salt pot, destroys the kidneys invisibly. Typical representatives: salt-baked cashews, spiced peanuts, pepper and salt walnuts, cream-flavored melon seeds. Kidney damage principle: 100 grams of salt-baked cashews contain 500 mg of sodium, which is equivalent to 3 grams of salt. The World Health Organization recommends that daily salt intake should not exceed 5 grams. A high-sodium diet can lead to 1. Blood pressure surges. Sodium ions absorb water, increasing blood volume and blood vessel wall pressure. Clinical data show that for every gram of daily salt intake, systolic blood pressure increases by an average of 2 millimeters of mercury. To renal ischemia, high-pressure blood flow continuously impacts the glomerulus, causing the filtration membrane to harden, just like a high-pressure water gun that flushes the wire mesh for a long time, eventually deforming the mesh. Real case: Xiao Li, an employee of an advertising company, must eat a bag of 100 grams of salt-baked peanuts every afternoon. 6 months later, a physical examination found that his blood pressure was 160/100 mHg and his urine protein was. The results of kidney puncture showed that some glomeruli had undergone hyaline degeneration. High potassium, minefield, pistachios and Brazil nuts, forbidden fruit for patients with renal failure. Potassium content comparison per 100 grams. High phosphorus bomb. Pumpkin seeds and pecans. Eating a handful is equivalent to drinking phosphorus solution. Phosphorus harm chain. Excessive phosphorus intake. Blood phosphorus 1.8 mol. Increased parathyroid hormone secretion, increased testicostal activity, bone decalcification, calcium and phosphorus deposition in the renal interstitium, further deterioration of renal function. Data warning: 100 grams of pumpkin seeds contain 1100 mg of phosphorus, which is equivalent to 1.6 times the daily phosphorus requirement of adults, 700 mg. A dialysis patient who ate 500 grams of pumpkin seeds per week had a blood phosphorus increase to 2.5 mol after half a year and had systemic bone pain. Bone density examination showed that the lumbar bone mass decreased by 30. I've seen many people like to use pumpkin seeds as snacks for watching TV series. Unknowingly, a small bag 50 grams of pumpkin seeds will bring 550 mg of phosphorus load, which is equivalent to the phosphorus content of drinking 200 ml of whole milk. IV high oxalate lurkers, almonds and peanuts catalysts, for kidney stones. The stone formula of oxalate, oxalic acid calcium oxalate crystals. Studies have shown that when the oxalic acid concentration in urine exceeds 0, the risk of stone formation increases significantly. Almonds: 20 grams of almonds contain 120 mg of oxalic acid, which is equivalent to 10 pieces of spinach, about 12 mg of oxalic acid per piece. Peanuts: 30 grams of peanuts contain about 80 mg of oxalic acid, which exceeds the same weight of amaranth, about 60 mg. Typical case: in pursuit of natural nutrition, fitness enthusiast Zhao Wang made a milkshake with 100 grams of spinach, 30 grams of almonds every day. After 3 months, he developed a severe back pain. Examination revealed multiple stones in both kidneys, with the largest stone reaching 0.8 cm in diameter. He had to undergo extracorporeal lithotripsy. Moldy nuts: aflatoxin, a kidney killer, more toxic than heavy metals. Aflatoxin B1 is 68 times more toxic than arsenic, and only 2 mg can cause acute liver failure in adults. Its damage to the kidneys is a two-way attack. It directly damages renal, tubular epithelial cells and aggravates kidney inflammation by inducing oxidative stress. Real tragedy: an elderly man in a rural area was reluctant to throw away damp peanuts, so he fried them and ate them every day. Half a year later, he developed oliguria and edema and was diagnosed with acute renal failure. Tests showed that the concentration of aflatoxin metabolite say, AFM1 in his blood exceeded the standard by 20 times, and he eventually needed lifelong dialysis. Identification tips: look at the appearance. Moldy nuts may have white or green mold spots on the surface, or the kernel color may become darker. Smell: normal nuts have a natural aroma, while moldy nuts have a rancid or moldy smell. Taste: moldy nuts taste bitter. Once you taste the bitterness, you should spit it out and rinse your mouth immediately. 3 most kidney-damaging nut processing methods. Frying. Hazards: trans fatty acids are produced by oil oxidation during frying. Every 100 grams of fried peanuts contains about 1.5 grams of trans fatty acids. Sugar-coated hazards: every 100 grams of honey amber walnuts contain about 30 grams of added sugar, equivalent to 6 sugar cubes. High sugar can lead to sudden rise and fall in blood sugar, damage to glomerular microvessels, insulin resistance, and increased risk of diabetic nephropathy. People who consume more than 25 grams of added sugar per day have an 18 higher risk of chronic kidney disease than others. Heavy flavor seasoning: mustard-flavored macadamia nuts, spicy peanuts. Trap: every 100 grams of spicy peanuts contains about 800 milligrams of sodium, equivalent to 4 grams of salt, far exceeding 80 of the daily salt intake limit. High sodium will increase the burden on the kidneys and cardiovascular system. At the same time, the health signal sent by the kidneys is regarded as a minor problem by many people. Frequent fatigue after soaking in water. 5 typical symptoms of kidney disease. 1. Many urinary bubbles. 2. Abnormal manifestations: fine bubbles float on the surface of urine, which do not dissipate within 10 minutes, similar to beer foam. Cause: damage to the glomerular filtration membrane, protein leaks into the urine, proteinuria. Misconception: many people mistakenly think it is anger. but proteinuria is actually one of the earliest signs of kidney disease. 3. Body swelling. For common parts, eyelid swelling when getting up in the morning, pitting edema of the ankles in the afternoon. Principle: the kidney's drainage capacity decreases, and water and sodium are retained in the body. Case: an office worker found that his instep was tight when he wore leather shoes. At first he thought it was weight gain, but later he learned that it was edema caused by kidney problems. 5. High blood pressure. 6. Abnormal value. Blood pressure 140/90, Mhg measured 3 times on different days. Association: renal ischemia activates the renin-angiotensin system, leading to increased blood pressure. About 50 of chronic kidney disease patients have hypertension. Anemia appearance. 7. Manifestations: pale face, bloodless lips, white nail beds. Causes: decreased secretion of erythropoietin by the kidneys, decreased hematopoietic function of the bone marrow. Misconception: often mistaken for iron deficiency anemia, and kidney problems, should be alert when iron supplementation is ineffective. 8. Easy to fatigue. 9. Characteristics: general fatigue that is difficult to relieve after rest. Even combing hair and climbing stairs are laborious. Mechanism: accumulation of toxins affects neuromuscular function, while anemia leads to insufficient oxygen supply. Ignored kidney alarm. 5 symptoms that are easily misjudged. 1. Nocturia. To definition: 3 times of urination at night, or nocturnal urine volume, exceeds half of the total daily urine volume. Causes: decreased renal concentrating function, common in chronic tubulointerstitial disease. Case: a retired elderly man got up 4 times every night for 10 years and thought it was because of old age. He did not go to the doctor until he had a loss of appetite and found that his kidney function had reached the 4th stage. 3. Calf cramps. For common time during sleep at night. Mechanism: calcium phosphorus metabolism disorder leads to hypochromicity and increased neuromuscular excitability. Misconception: it is often attributed to calcium deficiency. If cramps still occur frequently after calcium supplementation, kidney function should be checked. 5. Skin itching. 6. Characteristics: systemic skin itching, blood marks after scratching, worse at night. Cause: toxins such as urea are deposited in the skin and stimulate sensory nerves. Data: about 70 of dialysis patients have skin itching, and some people suffer from insomnia. 7. Wheezing and chest tightness. 8. Two possibilities: water and sodium retention, leading to pulmonary edema. Dyspnea worsens when lying flat. Severe anemia causing myocardial hypoxia. A chest tightness is obvious after activity. Case: a kidney patient was diagnosed with uremia pulmonary edema due to asthma. Repeated examinations did not reveal any heart problems. He was finally diagnosed with uremic pulmonary edema in the nephrology department. 9. Nausea and vomiting. 10. Typical scenarios: dry heaving when brushing teeth in the morning, abdominal distension and nausea after eating. Principle: toxins stimulate the gastrointestinal mucosa and affect gastrointestinal motility. Misconception: it is often treated as a stomach disease. Symptoms recur after taking stomach medicine and you need to be alert to kidney disease. VI from kidney health to kidney failure. There may be only a few habits. Top 5 behaviors that harm the kidneys. How many of them do you have? 1. Drinking too little water. 2. Dangerous dose. Daily urine volume 1000 ml, about 2 bottles of mineral water. Consequences: urine is concentrated, and crystal substances are easily precipitated to form stones. Studies have shown that people who drink less than 1000 ml of water a day have a 40 higher risk of kidney stones than others. Case: in order to reduce the number of times he went to the toilet, a programmer only drank 500 ml of water a day. 3 years later, he was found to have multiple kidney stones, with the largest stone reaching 1.5 cm in diameter. 3. Taking medicine indiscriminately. For high-risk drugs: non-steroidal antiinflammatory drugs, ibuprofen, aspirin, long-term use. Kidney tonifying folk remedies with unknown ingredients may contain R-estol, lowic acid. Certain antibiotics, such as gentamicin, mechanism drugs and their metabolites, directly damage the renal tubulus or cause allergic reactions leading to interstitial nephritis. Data: drug-induced kidney injury accounts for 15 to 20 of the causes of acute renal failure. 5. Staying up late and holding urine. 6. Double harm. Staying up late reduces immunity and increases the risk of urinary tract infection. Holding urine, increased bladder pressure. Bacteria easily retrograde to the kidneys. Case: a college student stayed up late to play games and held urine for a long time. After a cold, he developed fever and back pain. He was diagnosed with acute pyelonephritis, partial renal tissue necrosis. 7. High sugar diet. 8. Typical habits: a cup of milk tea containing about 50 grams of sugar in cakes and desserts as snacks every day. Chain reaction: high sugar insulin resistance, diabetes, glomerular sclerosis, diabetic nephropathy. Data: diabetes is the primary cause of chronic kidney disease, accounting for 46% of dialysis patients. Among Chinese diabetic patients, about 30 have concurrent kidney damage. 9. Sedentary. 10. Harm path: obesity, glomerular. 3. Highs: hyperfusion, high pressure, high filtration, glomerular sclerosis. Data: people with BMI 24 have a 28% higher risk of chronic kidney disease than those with normal BMI. Case: an administrative clerk has worked for 10 years and his BMI has increased from 22 to 18. The physical examination found urine protein, and the renal biopsy showed mild mesangial hyperplasia. Warning from Taiwan's dialysis kingdom: 100,000 people rely on dialysis to survive. In Taiwan, 1 in every 2,000 people relies on dialysis to maintain life, and the annual dialysis cost of the island exceeds $10 billion. Among these patients, 46 suffered from renal failure due to diabetic nephropathy. 30 had terminal renal disease due to hypertension. 15 were related to gouty nephropathy and drug damage. Anna Florigittles, who has been practicing for 20 years, lamented, about 20 of patients in the outpatient clinic have reached the uremia stage when they first visit the doctor. Their kidneys did not suddenly strike, but were neglected minor problems that dragged on for 10 years or even longer. The most regrettable thing is that 80 of renal failure could have been avoided through early intervention. Kidney protection is actually very simple. Do these 6 things well, and your kidneys will last 20 more years. Golden rule of diet: 3 less and 3 more. 3 less, reduce the burden on the kidneys. 1 less salt. To goal: daily salt intake 5 grams, about a beer bottle cap, including invisible salt, soy sauce, pickles, MSG. Practice: use a salt limiting spoon to grand spoon when cooking, and no more than 2 spoons per meal. Refuse pickles and pickled vegetables. The sodium content of a serving of pickled mustard tuber is equivalent to 50 of the upper limit of salt intake for the whole day. Choose low-sodium snacks. Ordinary potato chips contain about 500 mg of sodium per 100 grams. Switching to low-salt versions can reduce sodium intake by 40. 3 less sugar. For goal: daily added sugar 25 grams, about 6 sugar cubes. Stay away from sugary drinks. Comparison: a 500 ml bottle of cola contains about 50 grams of sugar, which is twice the daily upper limit. Homemade fruit tea no sugar contains about 8 grams of sugar, which is much lower than commercial milk tea, about 35 grams of sugar. 5 less purini. 6 restrictions: hot pot, thick soup, and animal offal should not exceed once a month. Purini content comparison per 100 grams. Pork loin, 130 mg high purini. Chicken breast, 100 mg medium purini. Egg, 12 mg low purini. 3 mores recharge the kidneys. 1 drink more water. To amount: 1,500 to 2,000 ml per day. Drink in divided doses, avoid drinking all at once. Occasion: drink a cup about 200 ml in the morning, before going to bed, and every hour of work. Observation: the color of urine should be light yellow. Dark yellow indicates dehydration, and colorless may indicate excessive drinking. 3 more fiber. 500 grams of vegetables, half of which is dark. 200 grams of fruit. Avoid high potassium varieties per day. Recommendations: low potassium vegetables, cabbage, cauliflower, red bell pepper. Potassium content per 100 grams, 150 mg. Low potassium fruits, apples, strawberries, grapes. Potassium content per 100 grams, 150 mg. 5 more high-quality protein. 6 amount hazira. 8 to 1 gram per kilogram of body weight per day, such as 50 grams per day for 60 kilograms. Preferred: fish, salmon, sardines rich in omega-3. Eggs. Egg white contains essential amino acids for the human body and almost no phosphorus. Beans, tofu, soy milk. Plant protein, less metabolic waste. Adjustment of lifestyle habits, protect kidneys from details. 1. Control 3 highs. To diabetes, control glycosidic hemoglobin below 7, and check urine microhemoglobin regularly, at least once a year. Hypertension, control blood pressure below 130/80 mmHg, and give priority to antihypertensive drugs that protect the kidneys such as ACE/ARB. Hyperlipidemia, low-density lipoprotein LDL, should be controlled below 3. For mol, and statins should be taken if necessary. 3. Regular physical examinations. For required items: urinalysis, check protein, occult blood, serum creatinine estimate, glomerular filtration rate GFR, blood pressure, blood sugar. Frequency: once a year for healthy people, once every 6 months for high-risk groups, diabetes, hypertension. 5. Don't hold urine. 6. Harm: if you hold urine for more than 2 hours, the pressure in the bladder will increase, and bacteria will easily go back to the kidneys, increasing the risk of pyelonephritis. Suggestion: develop the habit of urinating every 2 hours, urinate before going out, and avoid deliberately holding urine. 7. Use medication with caution. 8. Principles: painkillers should not be taken more than 3 times a month, such as ibuprofen. Chinese medicine should be diagnosed by a regular Chinese medicine practitioner. And herbs containing aristo, low-chic acid such as Aristolochial Anciatola and Stephania tetradarna should be avoided. Antibiotics should be strictly followed according to the doctor's instructions, and the dosage should not be increased or decreased on your own. 9. Take a warm bath. 10. Benefits: the water temperature is 38 to 42. And each time for 15 minutes can promote blood circulation and relieve renal ischemia. Note: patients with heart failure and severe edema should avoid. Patients on dialysis should not take a bath immediately after the treatment is over. Drink a cup of warm water before taking a bath to prevent dehydration. Not strategy for patients with kidney disease. Eat them safely in this way. 1. Calculate potassium and phosphorus load. To method: eat 30 grams of nuts and reduce 30 grams of lean meat, about 1 tel or 50 grams of tofu on the same day. Take 15 grams of walnuts for breakfast and reduce 15 grams of chicken breast for lunch. 3. Pretreatment to reduce oxalic acid. 4 steps. Soak almonds and peanuts in water for 4 hours can remove about 30 of oxalic acid. Drain and bake in an oven at low temperature, 160 C, 10 minutes to further destroy oxalic acid. Principle: oxalic acid is easily soluble in water. Heating can make it bind to protein and reduce the absorption rate. 5. Low phosphorus and low potassium cooking method. 6. Boil nuts. Boil walnuts and hazelnuts for 10 minutes and discard the soup to reduce the potassium and phosphorus content by 20 to 30. With calcium supplements, take calcium carbonate chewable tablets. When eating nuts, please follow the doctor's advice. Calcium can bind to phosphorus in the intestines and reduce absorption. Kidney protection misunderstandings: these common sense are actually pitfalls. More urine means good kidneys. Wrong. It may be due to poor concentration function. Truth: healthy people urinate for 2 to 6 times during the day and 0 to 1 at night. If you don't drink much water but urinate a lot, such as daily urine volume 2500 ml, especially frequent urination at night, it may be that the renal tubular concentrating function is impaired, which is common in the early stages of chronic kidney disease. Case: an elderly person thought he had good metabolism and urinated 3 times a day at night. He did not check until he felt weak and found that his glomerular filtration rate had dropped to 45 ml/minute, normal 90. I eat kidneys to nourish the kidneys. Wrong. Heavy metals and purines can damage the kidneys. Hazards: hyperemia. 100 grams of pork kidneys contain 132 mg of purine, which is higher than pork 100 mg. High heavy metals. As an excretory organ, pork kidneys are prone to accumulate heavy metals such as cadmium and lead. Studies have shown that their cadmium content is 5 to 10 times that of muscle tissue. Alternatives: black beans. Each 100 grams contains 36 grams of protein and is rich in anthocyanins. Yam strengthens the spleen and kidneys, contains mucin to protect the kidneys. I can't exercise if the kidneys are not good. Wrong. Moderate exercise can protect the kidneys. Research evidence: 150 minutes of moderate intensity exercise, such as brisk walking and swimming per week, can reduce the risk of chronic kidney disease by 20. Exercise is suitable for patients with kidney disease. The 8 Wanjin gentle stretching exercises to improve renal blood flow. Yoga: avoid inverted postures to prevent increased abdominal pressure. Cycling: slow walking on flat ground, 20 minutes each time. Taboo: avoid high-intensity resistance, such as lifting barbells, to prevent a sudden increase in blood pressure from damaging the kidneys. Your kidneys cannot withstand the consumption of luck. Remember Mr. Jiang, who used a cold as an excuse at the beginning. He did not seek medical treatment until he smelled urine all over his body. At this time his kidney function had dropped to the 5th stage and he had to start lifelong dialysis. The kidneys are like the water purifier at home. If the filter element is not replaced at ordinary times, when the water is turbid, the entire machine may be damaged. Starting today, you might as well make 3 small changes. Replace salt-baked cashews with plain walnuts, drink 1 less cup of milk tea every day, and drink a cup of warm water half an hour before going to bed. These seemingly small actions are all extending the life of the kidneys. After all, we only have 2 kidneys, and they will accompany us through 70 or 80 years of life. Don't wait until the doctor says 10 more kidneys wouldn't be enough before you learn to cherish what you have. The price by then may be spending the rest of your life on a dialysis machine.